Hello, dear friends. I welcome you all to this video of effects of Ramadan fasting on human body. So today we'll discuss about the effects of fasting on renal function or today fasting on the kidney. So first we'll see about the effect of fasting on kidney function. So Ramadan fasting has no significant adverse effect on the renal function of healthy fasting individuals. So there is no effect. Only thing is that there is a restriction in the fluid intake during the fasting period. So there can be a slight increase in levels of urea and creatinine in healthy fasting individuals because of the slight dehydration and restriction of the fluids. This increase is within normal range and could be due to dehydration and higher protein intake during Ramadan or the increased protein catabolism. So these levels decrease to baseline levels at the end of Ramadan. So we need not worry about the slight increase in the urea and creatinine levels in normal individuals. During Ramadan fasting, total water body content is conserved, though there is fluid restriction. So no harmful effects on health have been directly attributed to this fluid restriction. Still, we should try to take more fluids after iftar, particularly if the season is dry and hot, like summer season. We should try to take more and more liquids after the iftar or breaking the fast. It is said that at least you should take 2 to 3 liters of water before going to the sleep from the iftar to till you go to the bed. So that will clear all this slight increased urea and creatinine after the iftar. So taking fluid is very, very important after breaking the fast. Now coming to the effects of fasting on kidney diseases. So first we will discuss about with the patient's renal stones. Ramadan fasting has no significant effect, though there is fluid restriction. Sometimes some patients may get the colic of the renal stone. Patients with chronic kidney disease on hemodialysis who fast during on non-dialysis days show no risk of harm due to fasting. So there is no any effect of fasting on chronic kidney disease. Instead, improvement in serum albumin, phosphorus, and diastolic blood pressure and weight reduction has been noted along with maintained electrolyte balance. So this has been proved by many studies. No difference has been noted between the fasting and non-fasting groups on hemodialysis with respect to morbidity or mortality, including cardiovascular events. So even if the patient is having doing fasting and he is also on hemodialysis, there is no change in morbidity and mortality pattern of the patients who are on fasting and who are not on fasting. Now, kidney transplant patients with stable graft function who fast during Ramadan demonstrate excellent concentration ability along with no significant change in urinary and serum biochemistry. So this has been also be shown by various studies. In kidney transplant patients, the renal function, body weight, blood pressure, and urine volume are stable in fasting patients in comparison to those not fasting. No adverse events such as cardiovascular events, graft, or patient losses have been documented in these patients during Ramadan fasting. So there is no change as such on these type of patients, particularly who are with the kidney transplant because of the fasting. Patients of hypertension or cirrhosis of liver who are at high risk of developing acute kidney injury have significantly reduced the risk of developing AKI or acute kidney injury during Ramadan fasting as compared to non-fasting patients with similar comorbidities. So this is also shown by various studies. However, people with renal disease should be under physician supervision during fasting. So if a patient with kidney disease or any problem with the kidney or renal problem, the patient should take the advice of the physician before starting the Ramadan fasting. So that will be beneficial for him and he will not land up in any kind of trouble due to the fasting. So this is all about the effect of fasting on kidney and renal function. Thank you very much.